Hello, everyone, and welcome to our presentation on rural Latino mental health. We are Group 2, and our names are Melissa, Damaris, and Heather. We will share a little more information about us in a future slide. Next, we will hear from Damaris.
How many of you have heard the following, no tienes eso, which translates to you don't have that? Maybe you mentioned feeling depressed or alone and weren't heard, or perhaps you were ignored. We are here to say your mental health matters as a Latino and is important to us and should be to all of you. This is something we will unpack in our presentation, but before we start, we want to introduce ourselves to you.
My name is Heather Galvin, and I'm a co-founder of Rural Latino Mental Health. I've lived in Okanogan County for over 10 years now, and I am a proud Orville High alumni. I currently reside overseas with my husband, but I do help out with the campaign virtually.
Hi everyone, my name is Damaris Aguirre. I am from the Yakima Valley and I currently live in Cheney, Washington.
Hi, everyone. My name is Melissa Tisfamariam, and I'm the third co-founder of Rural Latino Mental Health. I was born and raised in Seattle, Washington, and currently live here. Now that you know a little bit more about us, I will introduce what we will talk about in our presentation. We will be introducing what mental health is, followed by the top 5 signs of mental health and Latino mental health stigma. Then we will talk about Latino mental health statistics, Okanogan County statistics, rural mental health services, and finally, additional resources. Damaris will start out by defining what mental health is.
What is mental health? It is our emotional, psychological, and social well-being. It affects how we think, feel, and act. Mental health also determines how we handle stress, relate to others, and make choices. Mental health is important to your overall well-being. So what happens when your mental health and well-being is disrupted? Next, Heather will walk us through the 5 signs of mental illness.
Thank you, Damaris. Yes, 5 signs of mental illness. First one is going to be excessive worry or anxiety or paranoia. Number 2 is going to be long-lasting sadness or irritability. So this may be crying for days and days on end. Number 3 is extreme changes in moods. Number 4 is social withdrawal. So you're no longer wanting to hang out with friends or family, you just want to be alone and alone for long periods of time. Number 5, changes in eating or sleeping patterns. That is a big one. So how many of you have maybe reached out to a loved one, a parent, and they have not given you the help they need? If this resonates with you, the next video you might be able to relate to. So that hashtag in the corner, hashtag Latino mental health stigma, is a very real thing. And that is something that we are trying to shatter and get rid of. So with that being said, I am going to introduce Miss Anne Lisette, who is going to let us in on why mental health is a Latino issue too.
Thanks, Heather. Mental health is a Latino issue too. Mental health stigma amongst the Latino culture is common. It's frowned upon and makes you sound loco or crazy to not seek help. But mental health does not discriminate. The Latino and Hispanic community has a range of experiences originating from immigration, acculturation, trauma, and generational conflict that can root mental health problems. The Latinx and Hispanic community also faces unique institutional and systemic barriers, which results in decreased ability to get help. In the next slide, Damaris will share some important statistics.
With that, here is a statistic. 10 million Latinos reported a mental health issue, but only 34% sought out mental health assistance. This means that 6.6 million Latinos are not receiving the help they need. Next, Heather will talk about why Latino mental health in Okanogan County is important.
There we go. Okanogan County. It is the largest county by size in Washington state. Unfortunately, it is also the poorest county in Washington state. So that is why we are focusing on Okanogan County. Amlisette is going to share a couple of interesting statistics about Okanogan County and describe a little bit more about why we chose to work with you guys.
Thanks, Heather. Why Okanogan County? Well, Okanogan has a very interesting demographic. We know several towns make up Okanogan County. However, due to significant travel distances and lack of mental health resources elsewhere, populations in these rural areas are not receiving the assistance they need. Most people are directed to the core location in the town of Okanogan, Washington. That's why we're here to bridge the gap. The pink bubbles on this slide represent important statistics. Starting out on the left, the Latino heart signifies that 19.4% of the population is Hispanic. The character and language symbols represent that 18.5% speaks another language at home. The broken piggy bank signifies that 13.5% live below the poverty line. The colorful flag represents that 0.5% are foreign-born populations. Lastly, the broken heart signifies that there are limited mental health services in this area. In the next slide, Heather will talk about our foundation.
Woohoo! Rural Mental Health Services. So that is our logo there in the middle. And you can see the yay and the wow. We were very excited to be here and be sharing this with you guys. So next, Amlisette is going to talk about the changes that we want to see in the community and how we are here to help you.
We are here to embrace mental health, particularly in our young Latino community. We have licensed therapists and counseling services to help provide mental health resources and support. We aim to spread positive mental health awareness, particularly in groups which have negative views, by eliminating the stigma against mental health. Diversity and inclusion is also very important to us, and we want to help all feel included and welcome to be themselves. Damaris, take it away.
So as you can see, these are some common questions we frequently get asked. The first question, as seen in the pink bubble, is, I don't have a car to go to my appointments. Well, don't worry, we provide online accessible resources and counseling, as well as scheduled transportation. Another common question we get asked is, seen in the yellow bubble, I can't afford your services. We have you covered with financial assistance and payment plans. Next, Heather will share our social media handles and how to receive help and resources.
Thanks, Damaris. Yes, asking for help is the first step. We've provided all of our social media handles, including Twitter, Facebook, Instagram, TikTok, YouTube, you name it. We even got a LinkedIn if that is your social media preference of choice. Our number is in the top left corner there with the hashtag in the blue bubble. We've also provided the suicide hotline number and a crisis counselor texting line. It's the crisis text line. It's free, 24/7 and completely confidential. So if you feel like you need to talk to somebody, that resource is there for you. And to finish out our presentation, we will have Amlisette share.
Thanks, Heather. And thank you all for listening to our presentation on rural Latino mental health. We hope you enjoyed it and learned few different things. Visit us at www.ruralmentalhealth.com for more information and helpful links. And from all of us to you, 3, 2, 1.
We would love to talk to you.
Talk to you. Bye.
Thank you guys. Bye-bye.